Professional Commentary, Normalcy versus Abnormality in the Context of Trauma by Dr. Franklin Edward Shoemaker, PhD, Substack Above and Beyond Politics, Mental Health and Education in Modern America, Premier Insights. Trending change. Normalcy is often understood as the baseline of functioning, predictable routines, stable emotions, and adaptive responses to stress. It represents the state in which individuals can navigate life with resilience, balance, and a sense of safety. Abnormality, when viewed through a trauma-informed lens, is not simply disorder or dysfunction. Rather, it is the adaptive but often misunderstood set of responses that traumatized individuals develop to survive overwhelming experiences. Hypervigilance, withdrawal, emotional numbing, or explosive reactions may appear abnormal to outsiders, but they are deeply rooted in the body's attempt to protect itself. Critically, abnormality is often experienced as normal by the traumatized child. Growing up in a lifestyle shaped by instability, fear, or neglect, the child knows no other reality. What appears chaotic or maladaptive to a caregiver from a secure, stable, non-traumatizing household may feel entirely natural to the child. This disconnect can be profoundly confusing for caregivers, who may struggle to understand why the child does not immediately appreciate or adapt to the safety and stability now offered. Even infants are not exempt from this dynamic. Babies who leave the hospital and enter caregiving environments shortly after birth can still be prone to the normality in abnormality. We must remember the powerful impact of genetics and the experiences a child endures in utero. Prenatal stress, maternal trauma, or environmental instability can shape the child's nervous system before they ever take their first breath. Thus, abnormality may already be embedded as a baseline, complicating the caregiver's efforts to provide stability and making early intervention essential. The distinction lies in interpretation. Normalcy reflects environments where safety and trust are present. Trauma-related abnormality reflects environments where safety has been shattered and the nervous system is forced into survival mode, even from the earliest stages of life. As professionals, we must resist stigmatizing these trauma responses as mere pathology. Instead, we recognize them as signals, evidence of wounds that require compassion, structured intervention, and pathways back to stability. In practice, normalcy is the goal of healing, but it must be defined not as conforming, but as reclaiming safety and agency. Abnormality in trauma is not failure, it is survival. Our role is to help individuals transition from survival to restoration while guiding caregivers to understand the child's worldview and bridge the gap between lived experience and healing. For infants and young children, this means acknowledging the role of genetics and prenatal experience and equipping caregivers with the tools to nurture resilience from the very beginning.